Welcome back. Time now to talk to our experts on very commonly asked questions around your health and wellness. Let's take a look. Well, you've heard of a heart attack. Who hasn't? But what about a leg attack? Now, leg pain is a symptom that is often dismissed as a normal part of aging or attributed to muscle strain. However, recent research has shed light on a concerning connection between leg pain and life-threatening cardiovascular events. This alarming correlation is known as the leg attack. Dr. V.S. Bedi, vascular surgeon from Delhi's Gangaram Hospital, is now joining us. Thank you so much for your time. We've come across this term called the leg attack. Explain to us what is this leg attack and why is it connected to our heart?
Yeah. So I think a lot of people, or most of the people, I guess, they know what the situation about the heart attack, which is basically when the blood vessels to your coronaries, the heart vessels, and all get blocked. So similar kind of problem that we face in the legs is that if the blood supply to the legs goes off suddenly because of some blockages or some clots going down to the legs and all, the patient can get severe pain, and probably if untreated and all within a few hours and all this sort of thing, the legs can become gangrenous. The patient can lose a leg also if they don't reach the hospital in time.
What's the connection really with, cardiac events? How does a symptom involving your legs, say leg pain, have a cardiac health connection?
Now, what we say is that basically a leg is basically a mirror of the heart. So condition of the leg vessels is a mirror of the heart. Any patient who's got some blockages in the legs, the possibility of that patient having a cardiac condition is almost 25% to 40%.
Dr. Bedi, my last question to you has got to do with the symptoms around the peripheral heart disease. What are the symptoms that one should be watching out for? Like, I've turned 40. Should I be cautious?
So, no, at the age of 40 and all, generally we don't expect this disease unless and until, like I said, that you have a condition of the heart or where, you have a lot of calcium in the blood vessels. When we do our cholesterol and all, if you're on the obese side, you're putting on too much weight and your activity is limited. You're not doing too much of activity. Then in that case, there is a possibility that you could have these kind of situations. And that is why then you will manifest with certain symptoms, which I can elaborate once.
Okay. All right. We have that out for our viewers as well as far as the symptoms of peripheral heart disease, artery disease, I beg your pardon. This is called PAD, and it's... we call it the leg attack. Of course, Dr. Bedi has put the spotlight on what exactly is leg attack. I'm going to thank you, Dr. Bedi, for joining in.
Thank you. Thank you.
This is something that none of us can deny, can we? All of us have held our bladder. Well, ostensibly, this is harmless. But if you are doing it once in a while, it is okay. But if you are not doing it once in a while and you've become habituated to holding your bladder, then you know that this is wrong. You are asking for serious trouble. We're examining how. Dr. Ashwin Malia, urologist from Delhi's Gangaram Hospital, is now joining us. Thank you for your time. Dr. Ashwin, holding your urine looks like looks like something which is not problematic, harmless, but it can lead to something as severe as kidney damage, isn't it?
Yeah, absolutely. See, holding your urine occasionally is okay. You don't have a proper bathroom nearby, that is okay. But making it a routine, making it a habit, especially we see this in shift workers like nurses, factory workers. So they will think that they'll finish their shift and pee later. But that's a big problem because it can lead to problems with the urinary bladder per se. The muscles can become weak. So the idea is to go and empty your bladder regularly without any, avoiding too much of delay. Otherwise, you're going to land up in a soup because of urinary tract infections, bladder stone formations. So all these problems can occur.
All right. I'm going to thank you, Dr. Malia, for joining us. So if you're holding your bladder for whatever reasons, avoid doing it, is what the experts are saying. How many of us have picked up vaping as a habit to do away with the habit of smoking? How many kids, young folks, are starting to use vape? Well, it has become a gateway product. Vapes, supposed to be banned in India, are still freely available, undeterred. Take a look at how they are being sold easily. It's easily accessible even by school children. We're decoding the habit of vaping right here. Dr. Vinit Banga, neurologist from Fortis Hospital, is now joining us. Thank you so much for your time. I want to ask you, vaping is not just harming our lungs, it's interfering with cognitive functions in young adults is what is being seen. Does vape inflame the brain? What's the evidence?
Yes, it does inflame the brain, and
Yes.
it is almost not as harmful as nicotine, but it is not at all free from the side effects. So it causes inflammation and atherosclerotic changes in your brain, mainly the blood vessels, which leads to narrowing of the blood vessels, problem with proper oxygen supply in the brain, which leads to subsequent damage to the brain. And in long-term use can lead to side effects such as stroke, dementia, and other issues.
Now, Dr. Sharad Joshi, pulmonologist, is now joining us. Thank you for your time. I want to ask you, vaping is stressing the heart out as well. Talk to us about why it is really as bad as smoking, and it's it's no better really in that sense.
The vaping is more dangerous actually. So what they thought that we will just put nicotine in it and we will reduce the content of tobacco. But actually what is happening is they are putting a lot of ingredients and fragrances and flavors in vape. So that people are getting addicted to nicotine as well as that particular fragrance or the flavor.
Okay. So nicotine is still there. Talk to us about those people who say that vape is an alternative to smoking then. We don't smoke, but we are vaping. What do you have to tell them, doctor?
So it's no better. Actually speaking, you are still addicted to nicotine, and nicotine is one content which is actually harming all the arteries and vessels inside your body. And that is how even the younger population is getting heart attack because of vaping.
Yeah, that's what we're talking about. A 21-year-old who very recently died of a heart attack. Family said no history of, smoking, but it was found that he was vaping from the age of 16. Let's tell you about another product that is supposed to be reducing harm. Well, at least that is how they are being marketed and sold. Nicotine pouches are small rectangular pouches filled with powdered nicotine, preservatives and other fillers for the flavor. Well, these pouches don't include tobacco leaves, so they aren't considered to be cancer-causing. Well, they're sold in varying strengths, but typically have a higher concentration of nicotine. But should you be going for them? Doctor, I want to ask you about another, ostensibly something that, ostensibly reduces harm, which is nicotine pouches. Are these pouches that are becoming very popular safe?
Unfortunately, when they say that we have reduced the danger of smoking, what used to happen was that when a patient or a person was actually smoking a cigarette, he was inhaling 7,000 chemicals because of other content of tobacco and whatever was being burned or lit. But when you talk about nicotine pouches or when you talk about vaping, you are still consuming nicotine. And nicotine is one thing which is not only harming your lungs or your, when you put the nicotine pouches in your mouth, it is actually damaging your mucosa. So risk of oral cancer is still there.
All right. So nicotine pouches clearly aren't something that you should be reaching out for. Certainly not vape, not nicotine pouches. Well, I think this is cold turkey, going cold turkey on smoking is something that maybe doctors would recommend, clearly. I'm going to thank you, Dr. Joshi, for joining in and sharing your thoughts with us. Monsoons have become synonymous with eye infections. Why is it so common during this season, and what can you do to help yourself? How often should you be getting an eye checkup done? Expert on the show is answering these questions. And joining us right now is Dr. Purendra Bhasin. He is an eye surgeon. Thank you for your time. I want to ask you, why is this that everyone seems to be developing an eye infection with the onset of the monsoon season, Doctor? What is really going on here?
Thank you for inviting me, first of all. And monsoon season, always this invites a variety of infections in the eye. The reason is that the and humid, the environment, it is a very good culture medium for all these bacteria, fungi, and all these organisms to grow.
So how does one really keep it safe? I understand that eyes perhaps are one of the most important yet the most neglected organs, in our bodies. Essentially, we only go to an eye doctor when there is a problem. What's your advice? What's your suggestion? Number one, on how to keeping our eyes safe, and then do answer my question on how important are regular eye checkups, doctor.
Okay. Firstly, you should not touch your eye. You should not rub your eye. Because when you touch your hand somewhere, anywhere, maybe in the common places, in the buses, in the platforms, in the train, or in the office, so you catch infections in your hands. So in your fingers, when you rub your eye, so you develop infection in your eye.
Okay.
Secondly, if at all you develop these kind of infections, so you should go to the nearby surgeon, eye specialist, and ask for the antibiotic. If you go to the common, the shopkeepers, they will suggest you to start steroids, which should be avoided in all these cases.
Nowadays, there are fairly common, eye drops in the market for these irritations in your eye. Are you saying that these medicines are to be avoided, doctor, over-the-counter medicines, and eye drops are to be avoided?
That should be avoided, strictly avoided. Because they commonly they are having corticosteroids, which can lead to a variety of adverse effects. So they should be prescribed only by the specialist.
I'm going to thank you, Dr. Bhasin, for joining in and sharing your views with us.
Thank you.
Thank you. We often associate dementia with memory loss, but there is more to this disease than just losing your memory. Lack of empathy, paranoia, many other symptoms that are being associated with dementia now. We'll tell you what you can expect and look out for. Talking a little about dementia, what are the hidden behavioral signs of this problem, of this disease? How is, now that is being seen loss of empathy as a sign, there's also a personality shift that maybe most people don't talk about, isn't it?
Yeah, and very important question, because when we think of dementia, we think only about forgetfulness, that you don't remember things. But what we forget that is the brain also has other functions, which means the brain has functions with regards to emotions, whether you are happy or sad. Brain also works with judgment. A lot of judgment is important. So whenever a person has dementia, all the domains of the brain, the function that the brain does, get affected. And it is not only the memory, the emotional part of it also gets affected. So if you are, the patient sometimes lose empathy altogether. They become emotionally blunt, emotionally silent. At times they become aggressive as well. So, and this personality change, this empathy, loss of empathy, and problem with affect and mood is many a times overlooked. We just focus on the forgetfulness, while at the same time, we ignore these small, subtle changes which happen in patients' behavior and personality.
Including paranoia, isn't it, Dr. Banga? Mistrust. There is something that one is seeing in patients of dementia. Repetitive behavior is also something that's being seen in these patients.
Yes,
why do they experience paranoia?
Yeah, so a part of the brain, which is frontal lobe, is important for the judgment. And that is why these patients have repetitive, perseverative behavior, and they keep repeating the same things. And your behavior also is controlled by the frontal lobe. So if the patients have problem with frontotemporal lobe, they tend to have more delusions, hallucinations, and more paranoia, and their paranoid behavior. They'll keep suspecting something or the other. So this is very common, and one of the dementia is frontotemporal dementia, which especially has these symptoms more than Alzheimer's dementia, which is the most common type of dementia that we come across.
All right. I'm going to thank you, Dr. Vinit Banga, for talking to us and, putting the light on such an important topic, dementia, and the hidden symptoms of which many of us perhaps overlook. Thanking you again.
Thank you so much. Thank you.
It brings us to the end of this edition of Health 360. We've put together all these stories for you. You can find them on our website, which is indiatoday.in. You can download the India Today app as well. You can also find them on our social media platforms like YouTube, Instagram, Twitter, or X, and of course, Facebook. Our hashtag is Health360, Health360 Plus. Do catch them, like, subscribe, and share. Do not forget. Thank you for watching. Take good care of yourself. Bye for now.